Stroke is one of the most time-sensitive medical emergencies, and the FAST rule exists because every minute determines the outcome. When a stroke occurs, the brain loses its blood supply, which means millions of neurons die each minute. The FAST rule was created to help ordinary people identify stroke symptoms quickly and accurately without any medical equipment. Instead of relying on complex tests or waiting for symptoms to worsen, FAST focuses on the most visible and early signs of stroke, allowing immediate recognition within 1 minute. Studies show that individuals who receive medical treatment quickly, especially within the first few hours, have a dramatically higher chance of recovery and a reduced likelihood of severe disability. Without early detection, patients may suffer long-term complications such as paralysis, speech problems, memory loss, or even death. That is why understanding the FAST rule is essential not only for healthcare workers, but for everyone. Stroke can happen at home, at work, or in public, and often the first person to witness the symptoms is a friend, coworker, or family member. By knowing FAST, anyone can become the first responder who makes a life-saving difference. The first part of the FAST rule focuses on the face because facial muscles are directly controlled by specific areas of the brain. When blood flow to these areas is disrupted during a stroke, weakness or paralysis often appears on one side of the face. To check for face drooping, ask the person to smile or show their teeth. Observe carefully whether one corner of the mouth droops, looks uneven, or fails to move at all. In many cases, the eyes may also appear asymmetrical, or the affected side of the face may feel numb or heavy. This symptom can be subtle or very noticeable, depending on the severity of the stroke. Some people may dismiss facial asymmetry as tiredness or a temporary problem, but in the context of a stroke, it is a critical red flag. Early recognition of facial drooping helps identify stroke quickly, especially when combined with other signs. Even if the smile looks only slightly uneven, it is better to treat it as an emergency and proceed with the remaining FAST checks. Arm weakness is the second key sign in the FAST rule because strokes often affect the brain regions responsible for motor control. When these areas are deprived of blood supply, the ability to lift or control one arm becomes compromised. To check for arm weakness, ask the person to raise both arms straight in front of them. A normal response is for both arms to rise evenly and stay in position. However, if one arm drifts downward, shakes uncontrollably, feels numb, or cannot be lifted at all, this strongly suggests a stroke. Some individuals may experience weakness only on one side of the body, affecting not just the arm, but also the leg and face on the same side. Even mild weakness should not be ignored because stroke symptoms can worsen rapidly. Arm weakness reflects a direct impact on the brain's motor pathways, and identifying it early allows faster activation of emergency response. Combined with facial drooping and speech difficulty, this sign significantly increases the likelihood that the person is experiencing a stroke and needs urgent medical care. Speech difficulty is one of the most alarming signs of stroke because it indicates that critical language centers in the brain are affected. When blood flow to these regions is disrupted, a person may suddenly struggle to speak clearly, understand language, or form coherent sentences. To test for speech difficulty, ask the person to repeat a simple phrase, such as, "Today is a sunny day." Listen closely for slurred speech, unusual pauses, confusion, or incorrect words. In some cases, the person may be conscious but unable to speak at all, even though they appear to understand what is being said. Other individuals may speak normally but seem unable to comprehend simple instructions. Speech problems can vary from mild to severe, but any sudden change in speech is a major red flag for stroke. Many people mistakenly assume the person is tired, stressed, or simply confused, leading to dangerous delays. Recognizing speech difficulty as a stroke symptom can ensure that emergency services are called promptly, improving the chances of survival and long-term recovery. The final and most important part of the FAST rule is time, emphasizing the urgency of immediate action. If any of the FAST signs appear, face drooping, arm weakness, or speech difficulty, you must treat the situation as a medical emergency and call emergency services right away. Do not wait to see if symptoms improve. Do not allow the person to rest or drive themselves. Strokes evolve quickly, and every minute without treatment causes more brain damage. Emergency medical teams are trained to assess stroke symptoms, provide early interventions, and transport patients to specialized hospitals equipped with stroke treatment capabilities. They can begin life-saving care even before arriving at the hospital. Many stroke treatments, such as clot-dissolving medications, must be administered within a narrow time frame, typically within 3 to 4. 5 hours after symptoms begin, the sooner medical care is initiated, the greater the chance of minimizing disability and improving recovery. By acting fast, you help preserve brain function, mobility, speech, and cognitive ability, giving the patient the best possible outcome. While the FAST rule identifies the most common and visible stroke symptoms, several other warning signs can occur alongside or even before these indicators. Sudden numbness or weakness in the legs, particularly on one side of the body, is another concerning symptom. Some individuals experience sudden confusion, trouble understanding speech, or difficulty concentrating. Vision changes, such as sudden blurred or double vision, may also signal a stroke affecting the visual centers of the brain. A severe, sudden headache, often described as the worst headache of a person's life, may indicate a hemorrhagic stroke. Loss of balance, dizziness, or difficulty walking can occur when stroke impacts the brain regions responsible for coordination. Even difficulty swallowing or sudden fatigue may appear. Although FAST provides the quickest method of detection, these additional symptoms help confirm the suspicion of a stroke. Recognizing them strengthens your ability to act decisively and call emergency services immediately. The more symptoms present, the more urgent the situation becomes. The FAST rule saves lives because it empowers ordinary people to detect stroke symptoms quickly, often before medical professionals arrive. Most strokes occur outside of hospitals at home, in public, or at work, meaning family members, coworkers, or bystanders are often the first to witness signs of stroke. Without FAST awareness, precious minutes may be wasted trying to assess the situation, hesitating, or assuming the symptoms will pass. By using the FAST rule, anyone can instantly recognize the danger and take immediate action. Early treatment dramatically improves outcomes. It can restore blood flow, reduce brain damage, shorten hospital stays, and increase the chances of a full recovery. In contrast, delayed treatment often results in long-term disability impacting mobility, memory, speech, and independence. FAST is not just a medical guideline. It is a life-saving tool that everyone should know. Teaching FAST in schools, workplaces, and communities increases public awareness and reduces preventable deaths. Knowing how to apply FAST means being prepared to save someone's life in 1 minute. Many people misunderstand stroke symptoms or underestimate their severity, leading to dangerous delays in treatment. One common misconception is that symptoms must be intense or dramatic to indicate a stroke. In reality, even mild face drooping, slight arm weakness, or subtle speech changes can signal the beginning of a major stroke. Another misconception is that symptoms will disappear on their own or that the person needs to rest. Stroke symptoms do not improve without medical intervention. They often worsen rapidly. Some believe strokes only happen to the elderly, but strokes increasingly affect younger adults due to stress, smoking, poor diet, and lifestyle habits. Another dangerous myth is attempting home remedies, drinking water or taking aspirin without medical guidance, actions that can worsen certain types of stroke. The FAST rule bypasses these misconceptions by providing clear, simple steps for immediate action. Understanding these misunderstandings helps prevent hesitation and ensures that people act quickly when stroke signs appear. Increasing public awareness of the FAST rule is one of the most effective strategies in stroke prevention. When people recognize symptoms early, patients receive treatment sooner, dramatically improving survival rates. Community education such as posters, workshops, healthcare campaigns, and digital content helps spread FAST knowledge widely. Encouraging family members, especially those living with older adults or individuals with high-risk conditions, to learn FAST can make a significant difference. Schools and workplaces can also integrate FAST training as part of health and safety programs. By understanding the importance of early detection, People become more proactive about managing their own health, such as monitoring blood pressure, controlling diabetes, and avoiding smoking. Fast awareness not only saves lives during emergencies, but also motivates ongoing prevention efforts, reducing the overall burden of stroke in society. The FAST rule is more than a checklist. It is a life-saving method that anyone can use to recognize a stroke within 1 minute. By understanding how stroke affects the brain and knowing the signs of face drooping, arm weakness, and speech difficulty, you gain the ability to respond quickly and confidently during a critical moment. Time is the most powerful factor in stroke treatment, and calling emergency services immediately can prevent permanent brain damage or death. Stroke can occur to anyone, regardless of age or lifestyle, which is why fast awareness is essential for every household and community. Sharing this knowledge with your family, friends, and coworkers may one day save a life. Remember, when a stroke happens, seconds matter. Learn fast, act fast, and help protect the people you care about from one of the most serious medical emergencies.